Hi, I'm going to talk about safety of adding salmeterol to fluticasone propionate in children with asthma. Background: long-acting beta agonists have been shown to increase the risk of asthma-related death among adults and the risk of asthma-related hospitalization among children. It's unknown whether the concomitant use of inhaled glucocorticoids with LABAS mitigates those risks. This trial prospectively evaluated the safety of the LABL salmeterol added to fluticasone propionate in a fixed dose combination in children. Let's go to see a video.
Asthma is a chronic long-term condition that can be managed but not cured. Asthma affects the airways of your lungs. It causes the airways to narrow and swell, resulting in wheezing and difficulty breathing. During breathing or respiration, air goes in through our nose or mouth to the upper airways, at which point it reaches the windpipe, which branches into two large bronchi to reach the lungs. The lungs are protected by the rib cage, which also contains the muscles that control your breathing. In asthma, the airways are oversensitive and easily irritated by certain triggers, called asthmatic triggers. Most people with asthma are described as atopic, meaning they have an allergic type reaction to external triggers, such as house dust mites, pollen, cigarette smoke, animal fur, and chest infections. However, for some people, the onset of asthma is unpredictable and may be caused by anxiety, stress, or even laughter. An asthmatic trigger causes the airway walls to swell and the muscles around the airways to contract. The airways narrow, and breathing through them produces a whistling sound called wheezing. Mucus is produced from the lining of the airways, which clogs up the narrowed airways further and causes coughing. This makes normal breathing more difficult, producing symptoms of asthma that can be mild, moderate, or severe and life-threatening, where hospital treatment is needed. The narrowing of the airways is reversible if the trigger is removed, or if the inflammation is treated medically.
Methods: we randomly vaccinate in a radio children 4 to 11 years of age who require daily asthma medication and had a history of asthma exacerbation in the previous years to receive fluticasone propionate plus salmeterol or fluticasone alone for 26 weeks. The primary safety endpoint was the first serious asthma-related event, as assessed in a time to events analysis. Let's go to see a video.
Asthma is a chronic respiratory condition where the airways in the lungs are inflamed and narrowed, causing breathlessness, wheezing, chest tightness, and coughing. Symptoms come as recurrent episodes known as asthmatic attacks, most commonly at night or early in the morning. Asthma is usually diagnosed in childhood and lasts for life. The lungs contain millions of air tubes or airways called bronchi and bronchioles, which bring air in and out of the body. The airways have a layer of smooth muscle in their wall, which enables them to constrict or dilate. In response to the body's higher demand for air, such as during exercise, the airways dilate to increase airflow. In the presence of pollutants in the airways constrict to prevent the lungs from being polluted. In people suffering from asthma, these airways are inflamed, narrowed, and become more sensitive to certain substances. Asthmatic attack happens when the airways react to these substances. During an attack, the smooth muscle contracts.
Results: among the 6,208 patients, 27 patients in the Fluticasone Salmeterol group and 21 in the Fluticasone alone group had a serious asthma-related event. The hazard ratio with Fluticasone Salmeterol versus Fluticasone alone was 1.28. A total of 265 patients. It's 8.5% in the Fluticasone Salmeterol group and 309. It's the 10%. In the Fluticasone alone group have a severe asthma exacerbation. And let's go see another video.
Advair discus is the brand name for the combination of fluticasone and salmeterol, which is used to treat asthma and was approved by the FDA in 2000.
When fluticasone and salmeterol are combined, they form a prescription drug which is available only under the brand name Advair discus. This medication is made up of a bronchodilator, salmeterol, and a corticosteroid, fluticasone. Like other bronchodilators, the salmeterol in Advair discus causes the muscle cells around a person's airways to relax, in turn opening them and making breathing easier. Meanwhile, the fluticasone component of this medication serves as a powerful anti-inflammatory in the airways, easing some of the long-term symptoms of the disease. Advair discus is most commonly used in the treatment of asthma. It can also be prescribed to treat bronchitis in people with chronic pulmonary obstructive disease.
Conclusions: in this trial involving children with asthma, salmeterol in a fixed dose combination with fluticasone was associated with the risk of a serious asthma-related event that was similar to the risk with fluticasone alone. And see the last video. It's about fluticasone. That's some benefits of fluticasone, and thank for watch this video.